Good afternoon, everybody. This is Marilyn Francis from the Patient-Centered Primary Care Collaborative. Thank you so much for joining us today. We have a really good learning session today on the right question, wrong person, a toolkit to facilitate cost of care questions in healthcare systems. And we will be hearing from, we have 3 speakers today, and we'll be introducing them and giving you a little bit more of their bio in a minute. But before we begin, I just want to let you know we do not have any handouts today, but you can download the slides. And if we do post any additional resource materials, you'll be able to click on the handouts pane to get the slides and the materials. Also, if you have questions, please submit your questions at any time by typing in the box that's labeled questions, and we'll do a Q&A at the end of each session. Also, raise your hand if you'd like to speak, ask questions, or participate in the conversation. You will be unmuted. And also, you can adjust the size of the speaker panel and the slideshow. Okay. And then after the webinar, we do have a survey, and we would very much appreciate you completing the post-webinar survey. Your feedback is very valuable to us as we continue to improve the quality of the webinars that we produce. And also, we will be sending you the recording and post the slides and the additional materials on our website, www.pcpcc.org/webinars. And before we begin, let me just give you a little bit of information about the PCPCC, the Patient-Centered Primary Care Collaborative. We have that mission to promote collaborative approaches to primary care improvement. And those approaches include like patient-centered care, person-family engagement, patient activation, and improved cost, quality, and experience outcomes. The PCPCC is a support and alignment network working with the Transforming Clinical Practice Initiative that's held by CMS. And this, as a support and alignment network, we're using a collaborative approach for improving person and family clinician and community strategies for engagement. And as you'll see on the slides, we have a pretty robust resource library that includes bite-sized learning modules, newsletters, the PCPCC Connect. And so I really do encourage you to take a look at our website, our TCPI page, and look at the resources that we have available. And now I will hand this over to Susan to continue.
To Kelly.
Kelly, I'm sorry.
No problem. This is Kelly Rand, the Program Officer for Choosing Wisely at the ABIM Foundation. And as Marilyn said, we're very excited to bring you this session as part of the Choosing Wisely series we've been doing in collaboration with PCPCC. I'm going to talk a little bit about the objectives, but I did want to say that we think this is an important element to TCPI, particularly the patient and family engagement metrics that you're working on. We've talked a lot about different ways to communicate about overuse and ways to involve patients in this, but cost is one of those new evolving, and maybe not that new, but evolving issues that really impacts patients a lot and can be drastically impacting their care. So if you're not having shared decision-making conversations about cost, your patient can leave the office and not fulfill the prescription, not go and do the tests that you've recommended because they can't afford it. And they just may not be confident enough or comfortable enough to tell you that that's an issue. Or they may not know until after they've left the office. So we do think that there's a lot of connection between the talk that we're going to give about having cost conversations that really do help health systems support the patient and family voice, that integrate the ideas of shared decision making, and really help patients become activated. So today in this webinar, we're going to learn the results of a multi-health system survey on cost conversations, We're going to understand the potential opportunities for integrating cost conversations into care. And we're going to share a toolkit that was developed in response to the survey responses. So really crowdsourcing what people thought would be the most effective things in their health systems from the people who are doing this on the front line. And now I'm going to turn it over to Dr. Lisa Letourneau to introduce the speakers for today. Thank you.
Terrific. Well, thank you, Kelly, and thanks everybody for joining. Thanks to PCPCC for hosting this in partnership with us at ABIM and Choosing Widely. So, First, we have Susan Perez, and I might just ask if folks aren't speaking to mute. We're having a little background noise there. There we go. So Susan Perez is a researcher with a research focus on understanding individual decision-making processes to develop healthcare policies, information, and resources, ultimately to promote high-value decision-making. She's currently an assistant professor at California State University in Sacramento, and prior to that completed a postdoctoral fellowship in quality, safety, and comparative effectiveness research, having earned a doctorate in nursing science and healthcare leadership at the University of California, Davis. Along with her, we're very pleased to have Beccah Rothschild. Beccah is a longtime friend of Choosing Wisely, currently serves as the principal of Health Engagement Strategies, a national consulting firm that focuses on patient engagement, health communications, health literacy, and culture change in healthcare. Prior to that role, Beccah served as a senior outreach leader for the Choosing Wisely campaign at Consumer Reports and has worked for over 20 years in the field of patient engagement, health literacy, health communications in a variety of roles, including direct service, project management, research policy, and implementing interventions. Beccah holds her master's degree in public administration and nonprofit management. So with that, thank you both so much for being willing to share your expertise and your thoughts. So I'm going to turn it to Susan.
Hello, thank you so much for that introduction. We would like to begin with acknowledging all those who helped us along the way for this project. I would like to thank and acknowledge those who provided professional expertise as physicians, pharmacists, and medical billers, as well as some research assistants in support of the development of the survey, revising and providing input on the toolkit, and analyzing our findings. We would also like to thank and acknowledge the ABIM Foundation for in-kind support in the development and dissemination of the survey and toolkit. This project was supported by the Robert Wood Johnson Foundation mini-grant administered by America's Essential Hospitals and the Essential Hospitals Institute. So for today's presentation, we'll begin with outlining the purpose of this project, our approach and methods for conducting this study, our findings and potential solutions, and lastly, recommended actions based on our findings. There is a growing need for patients and providers to engage in conversations about the cost of care. This is in light of rising patient out-of-pocket costs and waste in healthcare dollars, upwards to 30% in the United States. However, patients and providers are reluctant to engage in these cost conversations at the point of care, resulting in missed opportunities, like Kelly mentioned at the beginning of this webinar. So we embarked on this project to develop this toolkit in order to assist health systems in supporting healthcare personnel and recognizing opportunities for cost conversations, responding to cost questions, and redirecting and referring cost questions to the appropriate health system personnel. So the result is this toolkit that we're about to present to you today, that in addition to assisting health systems in the ways mentioned above, this toolkit will also highlight the deficits among health system staff about how to have cost of care conversations, the ways that those deficits impede staff's work, and their suggestions for proposed and actionable solutions. And also this toolkit advocates for health systems to invest in a culture of cost consciousness. We recognize that culture change and cost conversations are hard work. And so for that reason, this toolkit also highlights the barriers to implementing cost conversations, including which type of staff are reluctant to engage in these conversations, why they're reluctant to engage, and what can be done, either to motivate them to engage in these conversations or effectively redirect patients to the appropriate health system personnel. So for this study, we developed a survey instrument to measure health system personnel's experiences and perceptions with cost conversation. The survey instrument was developed based on a review of literature on existing survey tools inquiring about cost conversations between patients and healthcare staff, and using topics that emerged from qualitative interviews with patients and physicians, existing cost conversation survey instruments, and expert feedback from national leaders. And before we fielded this survey, it also went through 2 rounds of external review. We launched the survey in February of 2019 to a convenient sample of health systems that had completed a large Choosing Wisely implementation prior to the launch of the survey. A request was made to one leader to disseminate the survey widely within their health system to physicians, NPs, PAs, RNs, nursing assistants, LVNs, and medical assistants, as well as pharmacists, pharmacy techs, psychologists, counselors, case care managers, financial personnel, and administrative assistants, just about anybody who has an interaction with the patient. So during the 2-week time frame in which the survey was open, the research team also prompted the health system leaders with 2 reminders to recirculate the survey within their system. Of the 35 health systems invited to participate, 14 did so, and this netted a total of 523 respondents, and you can see the way they've been broken down on this table. So the major findings of this project are: patients are asking about costs, specifically out-of-pocket costs. Pharmacists, physicians, and health insurance companies and health systems are best positioned to talk with patients about treatment and medication costs, ways to lower those costs, and potential alternatives. Cost conversations should be normalized and not dependent on patient initiation. Staff demographics may play a role in who the patient talks about cost of care. And lastly, health system staff members have not been trained to discuss with patients, but many would like to be trained. So in this next section of our presentation, I will highlight the findings of our study, and Beccah and I will trade off, and she will introduce opportunities for change. Starting with our first finding, we learned that patients are asking about the cost of care. So according to survey respondents, the main questions asked by patients are, so 45% of respondents reported patients are asking some form of the question, what will it cost me? This includes a range of questions shared by survey respondents about out-of-pocket costs, which co-pays for appointments and medications, deductibles, supplements, minor non-durable equipment, and more. 20% of our respondents reported patients asking about alternatives to cost and treatment-wise. Patients are asking our respondents about foregoing and or delaying care, financial assistance programs, coupons, and opportunities to be treated elsewhere. 7% of respondents reported that patients are asking about indirect costs. Patients want to know how long they will be away from their job or family, how daily living activities may be impacted, and what side effects to anticipate. Lastly, 7% of respondents noted that patients are asking questions about understanding specific charges to bills, why they got a bill they weren't expecting, and why a test or treatment costs may be more than expected. For example, the same medication previously cost them less. So one of our respondents noted, patients are asking me, is there any cheaper? Why do I need this now? Can I put this off until I can afford it?
Great, thank you, Susan. This is Beccah. And as Susan said, she and I will be shifting back and forth as I talk about some of the opportunities and how we can translate our findings into actual action steps for health systems. So as a result of patients talking about costs, our survey respondents made suggestions of ideas or opportunities that their health systems and other health systems could consider in order to create change and better help their patients and their health systems. So please note on this slide and on the upcoming slide, I'll share these various opportunities that we're offering throughout our toolkit. But also at the end of our presentation, I'll let you know about existing resources that we put together in our toolkit to help you maximize on these opportunities and not to have to reinvent the wheel. So as you see here with opportunity number 1, as the burden of out-of-pocket costs continues to escalate, patients will likely have a growing number of questions. Health systems should take this opportunity to develop resources and tools so that patients can better anticipate and understand their costs and simultaneously create systems and workflows to be better prepared to answer cost of care questions, likely leading to improved patient outcomes and trust between patients and providers. And opportunity number 2 that we saw here was to create CME trainings on what alternatives are clinically high quality and evidence-based, since as you know, there's often more than one way to deliver high quality care.
Thank you, Becca. So we also learned that pharmacists, physicians, health insurance companies, and health systems are best positioned to talk with patients about costs. Pharmacists felt that they were best positioned to provide patients with information about cost of medications. Similarly, 34% of non-pharmacists felt that pharmacists were those who were best positioned to provide this information. Similarly, pharmacists felt that within their health systems, they were the ones who were best positioned to suggest cheaper alternate medications to patients. Similarly, other healthcare system staff also felt that pharmacists were best positioned to provide this information. Physicians felt that within their health system, they were also well positioned to suggest cheaper alternate medications to patients. And accordingly, other healthcare system staff also felt that pharmacists, physicians, and insurance companies were those who were best positioned to provide this information. Interestingly enough, none of the professional groups surveyed felt that there was one strongest candidate or professional group to discuss lowering testing and general treatment costs with patients. But overall, respondents from all professional groups felt that insurance companies were the ones who were best positioned to provide this information, followed by the health systems providing that information. Similarly, respondents felt that health and hospital systems were best positioned to provide information about the cost of tests and treatments, again, followed by insurance companies. Prescribers, such as nurse practitioners, physician's assistants, and registered nurses, felt that they were best positioned to have conversations about delaying and foregoing care due to cost. Similarly, 46% of survey respondents felt that prescribers were best positioned to provide this information. One participant noted that participants are looking for ways in which to support patients' cost concerns. I quote from one of our participant respondents, "I would like a training on how to have empathy when working with patients on cost issues and how to know what the most cost-effective alternatives are."
So one thing that we heard a lot about, as Susan just mentioned, is that our survey respondents felt that pharmacists were often best suited to answer questions about cost of medication. One suggestion that trended highly, and that you'll see listed here as opportunity number 3, was that for health systems that do not have an on-site pharmacy, to consider adding an on-call pharmacist to their care team. This would help patients at point of care be able to immediately ask questions related to medication costs. Similarly, as you'll see here in opportunity number 4, it was suggested to consider hiring and training staff to partner with patients at time of care to ensure that patients can get answers immediately about insurance and cost questions so that they could immediately determine if their proposed treatment plan was actually affordable to them. This could even be someone who can help patients figure out how to call their insurance company and stay on the phone to coach them with what questions to ask. So I know that this may seem like a big list, but we wanted to make sure to include it because it was so strongly recommended by survey respondents. To make it seem slightly less daunting, though, we do have information, as I mentioned, in the resources section of our toolkit to help figure this out.
So another one of our findings suggests creating environments and workflows that make cost conversations a consistent and regular component of a visit and not relying on patient initiation. 82% of survey respondents felt that there is no easy way to bring up cost conversations, even though they did report that the best time to do so was during patient intake and while discussing treatment options, and that doing this more frequently within these timeframes would help increase the frequency of these cost conversations. 52% of 52% of survey respondents indicated that patients initiate the majority of conversations about out-of-pocket costs, and that 39% are having these conversations at least weekly. Health system staff rarely initiate conversations about cost of care per survey respondents, though when they do, they are about out-of-pocket cost to patients, cost of illness, and the cost of coverage. Staff noted that they are looking for support to initiate and engage cost conversations. Could we create patient-appropriate tools or handouts to guide these cost conversations?
So one way to normalize these cost conversations, as you'll see here on opportunity number 5, is to really encourage them by proactively bringing up the issue of cost at check-in, on intake forms, while grooming patients, and while taking medical histories. But I think there might be someone who's not on mute in the background, if you'd like to mute your phone. Another suggestion we heard repeatedly is to hang posters in waiting rooms and other public areas to nudge patients to ask about costs and to let them know that such questions are welcomed and encouraged. Another resource that you'll find in our toolkit is suggestions on how to add doing something like this into your workflow, again, so that you don't need to make it up from scratch.
So we were surprised to learn that staff recognized that their race, ethnicity, perception of social status, and their role as a healthcare provider influences cost conversations. One physician noted, some patients are less likely to bring it up because I'm old.
And so here we suggest that your health system make the time and find the resources to develop a health system in which cultural awareness is deliberate and in which staff is aware of and sensitive to the varying financial realities of all patients. This is opportunity number 6. And as you'll see here in opportunity number 7, this is also a good opportunity to, at the very least, ensure that all visuals, such as posters, brochures, and videos, represent diverse patients. And I'd like to also add diverse staff if that is true of your health system team. You can also ensure that patient-facing materials specifically encourage patients to talk to their healthcare providers about costs by using words such as, talk to your doctor if you're concerned about the cost of your medicine, medical tests, treatments, or procedures. Consider providing scripting for your providers and staff so that they're more comfortable with this type of conversation, both in terms of responding to it and initiating it.
Our next finding is that we learned that only 33% of respondents reported that their health system had provided training to staff on how to handle or redirect cost questions. 67% reported that their health system had never provided such training. Only 14% of our respondents reported that their employers provided specific training on how to discuss treatment options with their patients based on their ability to pay for it, meaning that 86% did not. 28% of respondents reported that they did not need trainings related to cost conversations and or that it was not applicable to their job. However, when asked about the types of topics that could be covered in trainings about cost of care, 72% of respondents offered a range of suggestions. One participant noted additional value to training that could include knowing where and how to redirect patients' cost questions to the appropriate personnel. Training could be useful, but I don't believe as an RN it is within my scope of practice to provide this information. I should know, however, where to find the answer at least.
So a tremendous gap exists between health system staff whose employer has provided training on discussing cost of care related issues and those who feel they need to be trained on it. So there's a huge opportunity, as we point out here in opportunity number 8, for those who have not been trained on discussing costs with patients to do so. And one way to begin is with an organizational self-assessment. Our toolkit has links to some, which we hope you'll find useful. So now we're going to transition slightly and ask the question, what can we do to encourage these cost conversations? What are some actual actions that we can take? So the first thing that we recommend is to learn what questions your patients are most frequently asking about cost, and what resources your team can share with patients to help answer these questions. The second is to help your staff and colleagues engage in cost conversations so that they can respond appropriately to patients' questions around cost. And third, learn what your staff may want to be trained on so that they can have the most effective conversations as possible around cost issues. I was honestly stunned by the honesty and the in-depth responses that we got in our survey. And perhaps some of what we learned will resonate within your own health system and with your team. Or perhaps you may want to replicate our survey on an internal level at your system to learn more about what your team would like to learn and what you could do to help them feel more supported in these conversations. So this is the cover of our toolkit, Right Question, Wrong Person, a toolkit to facilitate cost of care questions in health systems. And what I'm going to do over the next couple of slides is to show you some screenshots of the toolkit so that you can actually see some of the resources that I previously alluded to. So this slide shows the resources that we provide for the action opportunity of learn what questions your patients are asking most frequently about cost, and what resources your team can share with patients to help answer these questions. In the left-hand column, we have a list of the types of questions we learned that patients are asking. And Susan mentioned some of them before, but just to reiterate some of them, some of the questions we heard that patients are asking are, what will it cost me? How much will I need to pay out of pocket, including copays and deductibles? What are my alternatives, cost and treatment-wise? Can you explain the costs to me? They don't make any sense. So then in the right-hand column, you'll see resources to share with patients with direct links. And so some of these, just to give you examples, include helping patients understand the basics of cost of care, providing information about delaying or forgoing specific treatment, discussing ways to help your patients understand about hidden and indirect costs of healthcare, or perhaps helping patients understand their explanation of benefits from their health plan. We also know that there will be barriers. For example, we heard from some survey respondents that patients do not ask questions about costs at all. But since we do want to encourage these types of questions, we offer a proposed solution to that at the bottom of this page, including conversation starters. Of course, there's also similar types of resources and for the other action opportunities in the toolkit. So I just wanted to give you that sample. And as you see now on this slide, I wanted to show you an example of our resource list by subtopic that's included in the toolkit. So as you'll see here, this page has tools for patients and healthcare consumers, separated out by cost estimators and money-saving techniques for general medical expenses, cost estimators and money-saving techniques for prescription medications, and resources for understanding and acting on medical insurance and medical bills. So some examples are how to research healthcare prices, how to speak up and save money on your prescription drug, how to shop around for lower drug prices, and how to read your medical bill. So again, we have resources also on other pages for healthcare systems and for provider-led cost of care conversations, as well as general resources. So our hope is that you'll be able to use these resources and all the others in the toolkit to help your organization and think about how to have improved conversations of cost with patients. So we hope that this has been useful to you. And while I know we have plenty of time today on the webinar to answer questions, we also invite you to reach out to Susan and I directly with any questions you have. And of course, we hope that you'll share this toolkit and that you'll use it. And the link at the very bottom here allows you to access it directly. And I believe that, if I'm not mistaken, that PCPCC will be sending out or has sent out this link to all of you so that you can access the toolkit directly.
Yes, we
will.
So at this point, go ahead.
Great. So I'll turn it back over to Marilyn or to Dr. Letourneau at this point, I think, to facilitate any questions that people may have.
Great. Well, this is Lisa. Unless, Marilyn, would you like to jump in at all, or I will go from
Actually,
here.
We don't have any questions yet in the chat box. So.
Okay, so this is Lisa Letourneau. Thank you again, Susan and Beccah, both for your work on this and for sharing your hard work and your research and the results and recommendations with all of us. Just a reminder to folks that you can chat your questions, or Marilyn, Kelly, remind me, they can unmute as well, right, and just speak questions, correct?
Yes.
Yeah, thank you.
And they can raise their hand.
So,
yes.
Okay, but then they have to say something.
Yeah, right. I don't have anybody raising their hand yet. So.
Okay.
We do. We have a couple people.
Oh.
And a couple questions
All
as well.
right, we'll just pause here. Yeah, so anybody want to jump in first with audio to ask a question?
I
think they came through. Yeah, okay. Okay, the first one is from Maria Melvin, who says, putting the cost out there might hinder patients to come back and seek health care. What do we do about that?
I can do that one. So in the previous research that we've conducted, at least with physicians, that in these interviews that we learned that in not talking about costs is what happens is they go to the pharmacy and then they learn that they can't afford it, and then it creates this back and forth, and administratively I've at least heard anecdotes about it actually creating an added burden. And so sometimes about talking about costs, yes, it does prevent patients from doing that, but at least it opens up the conversation. I can see that, but at least it opens it up. And in that conversation, and perhaps that conversation may include, is this something that is affordable to you or something that you can do? And that also opens the door for discussing treatment alternatives that perhaps are more accessible to the patients, or like we mentioned in the toolkit, payment assistant programs or assistance programs through pharmaceutical companies.
And just to add on to what Susan said, I think we've heard a lot too about how many more people are affected by cost now with high deductible plans and with exclusions in healthcare payment. So part of the reason we talk about normalizing it is because there may be a group of people who had never thought about asking about costs, which may now have an extraordinary burden, even if they have a very decent income, and how to think about how to integrate these costs into their life, so that they have there's probably a lot more people, and instead of trying to target just the people a clinician or someone in the health system may have a problem, really normalizing these questions makes it something open so that anybody who might have a problem can discuss it, and sort of takes that stigma away.
Great.
Okay.
Okay. Good thoughts. Other questions?
Yes. This one is from Catherine Schneider, and it says, let's see, can you comment on the use of the word cheaper versus low cost?
would like to take that one?
This is Becca. I have not read a lot on that, but I can talk about experience early on in my career. I worked in an adult literacy program, and we worked on a lot of these types of issues, and that is actually how I learned about the connection between limited literacy and lack of access often to quality healthcare. And what I learned then was that the word cheaper was frowned upon frequently, that it was perceived as something less than, that they were getting something of a poor quality. And so for that reason, the groups that I was working with at that point preferred not to use that word. But I can only speak to it in that context and not specifically in research to this particular project.
Yeah, and I would say we didn't look at cheaper, but we did do focus groups with Choosing Wisely on the word value, and people had a similar feeling that there's a lot of concern, I think, from patients in general, that there are different levels of care that you give. And I mean, certainly a health system that has concierge services does put that as a reasonable concern, but that when you hear words like value and cheaper, they think they're getting less quality instead of the same care. So it's more about financial harm when we talked about value. We did not specifically ask about cheaper though.
Great. And this is Lisa Letourneau, and I will certainly echo that as well. Again, not fully research-based, but in work around health literacy and patient engagement and communication, we have certainly landed on a similar conclusion to avoid that language and talk about value and, better choices, more efficient care, effective care, but yeah, staying away from that word. Other questions?
Okay, yes, from Beverly Layton. It says, how are you educating healthcare providers about this resource?
Kelly, are you able to share?
So our dissemination plan is, one, we're trying to get out to networks like PCPCC that we collaborate with to share the resource. This is not the only webinar we'll be doing like this. We're also doing it to the Choosing Wisely Learning Network. We're putting it out through all of our media venues as well, and we'll have it as part of the resource tools that we offer on the Choosing Wisely website. And it is also a part of the resources that Essential Hospitals offers on their website. So we additionally did send the survey out to all of the practices that participated so that their health systems could start testing these ideas that were based on the responses that they got. But that we're trying a pretty wide dissemination through different collaborative channels.
And certainly I think it's fair to say, Kelly, we would welcome other suggestions if folks have any.
Sure, that's a great point, and we would also welcome that if people would like more assistance than this webinar on how to do this, that we always offer through the PCCC SAN direct technical assistance, and we'd be happy to have a conversation with you on talking about how to implement it in your practice.
Yeah. Anything else to add? Okay, we'll go on to the next question. And this is from Kwok Vo from Note Scripts, and he's a pharmacy student. And during the survey and discussion of research, what major roles did you notice that pharmacy can step up and take initiative in?
This is Susan. That's an excellent question. I don't think the survey was designed to really assess that. I think that is because what the survey really did uncover was perceptions of healthcare staff and of pharmacists and pharmacist assistants and stepping up into certain roles, specifically to cost conversations about medications and medication and prescription options. But I think that's certainly a very interesting area of research to understand deeper about the ways in which pharmacists and pharmacist assistants might be able to step into those roles and how to support them in engaging in cost conversations. But we didn't go that far. This was certainly a first step into revealing that.
Great. Others? Again, you can either speak questions or chat.
So I have some more other questions. I have another from Beverly Layton asking, have you partnered with any pharmaceutical companies on this project?
No, the ABIM Foundation doesn't partner with for-profit organizations generally. Our research is done in the nonprofit sphere. So I should say that some of the health systems that voluntarily did it are for-profit health systems. That's a caveat. We are willing to help any health system, but when it comes to organizations, we tend to, just for conflict of interests, work with organizations that don't have vested interest in different results.
And to reiterate, this is Beccah. Since you had asked about if we, Kelly's answer is obviously correct, but just to add on that the project was supported by the Robert Wood Johnson Foundation, with a mini grant administered by America's Essential Hospitals and Essential Hospitals Institute.
Thank you, Beccah. Yes.
Hello, this is Griselda. Can you hear me?
Yes.
Yeah.
Yes. You're unmuted.
Great. Oh, thank you. I just had a comment and did have a question. Given my previous experience as a practice administrator for a family practice, I know that physicians are not comfortable a lot of times discussing the cost. Yeah, your survey did indicate that the physicians are the most adequate to answer alternative treatment. When a higher cost or the member's not able to afford certain procedures or costs. So yes, definitely that is accurate that physicians are the most adequate to answer those type of questions. I think there's in the survey, one of the actions or one of the things that you mentioned is to have somebody that can help patients, guide the patients through understanding, because there's still a lot of unknowns for the patients when they're getting a certain procedure, especially when they're going either on an outpatient procedure or inpatient procedure. And so there's a lot of cost. So I think organizations would benefit from having sort of a benefit specialist to be able to help patients identify those costs. And just as an example, on a personal note, I was very surprised when I went out to do it was a outpatient procedure that I was giving at the intake, and a package was sent specifying in a form letter that says these are the expected costs. And the facilities cost, they identified facility costs, they identified the anesthesiologist cost, they identified the provider's cost for the procedure, which I thought was very innovative, because I had not seen that in a while. And I think having those things, having those type of documents or forms that you can hand out to a patient or give to a patient prior to them even, having that discussion with the provider about having a certain procedure, it really helps the patients begin that conversation, and having somebody in an office that would help the patient navigate through the, there's various payers and insurance plans, and I think it would really benefit the patients when they can have somebody help them navigate through that process. So I think you're doing this survey really points out the issues that we've had, and it really gives understanding of what the opportunities are going forward. So thank you for that.
Thank you.
Thank you.
Okay, and also I have another hand raised of Maria Balbin. On the line. Hello. Hello?
Her question was answered earlier.
Okay. Okay, great. All right. Another question that I have here is if adding an on-call pharmacist might be efficient, would that in turn lower healthcare costs in the future?
This is Lisa. Can the person asking that question, do they want to say a little bit more? Or you can unmute on your screen. But it'd be great to hear a little bit more about your thoughts on that, because I think it absolutely could, but love to hear your thoughts.
Okay. Okay. They're unmuted. Oh, did they?
No? Okay. Well, maybe not, but anyway.
Oh, hello. Sorry, I was having trouble.
There we go.
Hi, yeah, my name is Kwok Vo. I'm from Nova Scripts. I'm a pharmacy student. And so I was thinking, like, since you mentioned that adding an on-call pharmacist is like more efficient and beneficial for the team, however, adding that is like an extra cost, that brings up healthcare along with possibly already having like a clinical pharmacist on the team. So like what are your perspectives of having an on-call pharmacist, like in terms of like future healthcare costs?
This is Susan Perez. This survey, this survey wasn't designed to kind of assess those costs or measure that. Our recommendation is if there is not currently a pharmacist or a clinical pharmacist on the staff that is readily available or accessible, the suggestion was to hire maybe an on-call pharmacist, or maybe make sure someone is readily available. But also from previous researches, we're finding that when we don't have those conversations, that it does end up in this back and forth administratively for the providers. And while we have not yet measured that, I think it is an interesting opportunity, especially considering specifically costs to patients, as well as administrative costs to the healthcare medical team that we don't actually see because of that background of the back and forth for cost conversations that are not happening.
Yeah, I totally agree. Yeah, thank you. I was just wondering your opinion.
Just one more element to it is that there's pretty good research that cost can significantly affect adherence. So as we progress from a fee-for-service payment plan to a pay-for-performance, adherence is going to make a significant difference. So there could be, just the benefits to society of people being able to know whether they can afford costs, but also benefits to the healthcare system, that they have more adherent patients because the patients are not deterred by cost.
Thank you. Yeah, I agree.
Ready for the next question?
Yes.
Okay, this one is from Teresa Gerard. And does the toolkit cover communications between pharmacists and prescribers to optimize the utilization of health plan formularies and assistance for patients and speed up the fulfillment process. Do you want me to repeat that?
Yeah.
Do you say yes? Okay. Does the toolkit, okay, does the toolkit cover communications between pharmacists and prescribers to optimize the utilization of health plan pharmacies and assistance for patients and speed up the fulfillment process?
This is Susan Perez again. So we were unable to, the survey wasn't designed to assess that, but I don't recall it. We provided a number of resources, and I don't yet think those resources exist. But going into this project, we were incredibly mindful of the diversity and different types of health systems that we were trying to influence and impact and provide meaningful information to. And so we kind of, what we do have are resources to guide health systems through the process of identifying those workflows, and do offer recommendations for general communication strategies, but we don't quite provide scripts or specific workflows.
Okay.
Great. Anyone else?
Comments? Right. I do have another question. It says, and I hope I'm pronouncing this right, this is from Daniela Pierre, and they're a DeVaco admin fellow. And the question is, do you think telehealth could help creating an overall culture of cost consciousness, especially for patients hesitant to speak directly to their providers? Hello?
Anybody want to take that one?
Can you repeat it one more time? There was a lot of
I don't this
hear
is
all of the words.
Sure. I don't.
Right. Okay. The question is, do you think telehealth could help create an overall culture of cost consciousness, especially for patients hesitant to speak directly to their providers?
It's a great question, but again, we didn't do, our survey in this specific case didn't look at anything about telehealth. Really interesting question. I don't have enough background on telehealth to speak to it though. Susan? Beccah?
Yeah, likewise. I'm sorry.
Likewise.
I don't, but I can't. Yeah, I can see that with certain cultures that, you know, when you're in the office, it does cause you a little more nervous. And so, I mean, more anxiety. And so perhaps like the distance between telehealth might make patients, but I think that's more of a discussion around the comforts of telehealth rather than, rather than cost conversations specifically. But again, I think that's like a really interesting question and something worth exploring.
Okay.
Great. Well, this is Lisa. We are coming close to the end of the hour, so I don't want to shortcut any questions. So I'll check in, Marilyn, anything else, but we probably should wrap here in just a minute.
Okay. No other questions. We just have a thank you. We have a thank you for sharing so much information, and they appreciated the webinar. So, but they had to leave the webinar. So, very good. So, okay.
All right. Super. Well, thank you again, everyone, Susan, Beccah, and everyone for participating. Marilyn or Kelly, do you want to wrap?
I just wanted to say thank you to everybody for participating, and please feel free to contact me, and also please visit our PCPCC.org website. We will be posting the webinar as well as the any tools that we have on our website. So Kelly?
Yes, just to reiterate what I said earlier is that we hope you'll use the toolkit, and we are also happy to have a conversation with you on how to have how to use the toolkit in your own practice. Lisa Letourneau and I are always happy to do technical assistance calls. So we really appreciate your coming on today. And Susan and Beccah, I always appreciate the work you do. And that's it for me.
Thank you, everybody.
Thank you.
Thank you.
Okay, thank you all.